It's a proven fact that animals, especially dogs, bring joy and comfort to most people who come in contact with them. Well, today we are visited by members of the PetSmart Pause for Hope at Orlando Health Pet Therapy Program to see how these canines are making a difference in the lives of those they visit. Hello and welcome to Healthy Connections. I'm Annetta Wilson, your host. Healthy Connections is a show dedicated to exploring a wide variety of topics, from prenatal care to Alzheimer's disease. And we do so with a wide variety of perspectives, from the professionals that help treat the syndromes to everyday people like you and me who may have personal experience dealing with these topics on a first-hand basis. Stay tuned for Healthy Connections. We start our discussion with the PetSmart Pause for Hope at Orlando Health Program Coordinator, Amy Flom, and her friend, Simba. And we know already Simba is going to be the star of this segment of the show. Amy, thank you for being here. Tell us about this really fascinating program.
Yep. Well, PetSmart Pause for Hope is Orlando's Health's pet therapy program. So we have pet therapy teams at 6 of the Orlando Health hospitals, visiting with patients, family members, and staff.
So the dogs actually go in and visit, and we have to tell you, Simba has his own name badge because he is officially an Orlando Health volunteer.
Correct.
So what's the difference between a therapy dog and a service dog?
Okay, so a service dog is a dog that's trained to assist one individual with some type of a disability. So that dog is owned by that individual and only works for that individual. A therapy dog is owned by their handler, and they go and visit with many people in challenging situations. That can be in healthcare, that can be in hospice situations, nursing homes, counseling situations. So a therapy dog is a dog that is trained to want to interact with people, want to support people in challenging situations, whether it's physically, emotionally, or, as I mentioned, even academically. Students now are having therapy dogs come in when they're going through final exams, and just to help de-stress and relax during those stressful times.
So Simba is your dog?
Simba, I own Simba, and I raised him from a puppy. And I trained him in the normal obedience type training. And I early on could tell he had the temperament to want to interact with people and really love on people.
So is there a separate training outside of the obedience training that you normally go through that these animals have to undergo to be therapy dogs?
Not necessarily a separate training, but you need to socialize them well.
Okay.
They need to be dogs that are not going to react to anything. They need to...
Which is why we're not playing with Simba, because he would get really excited.
But in terms of like other dogs, they need to be able to be around equipment, other people that can look very different in different circumstances, loud noises, other animals. They need to be very non-reactive, very calm animals. Okay. And so I knew he had those traits, and I had an interest in working in the healthcare situation, and so that's how Simba and I got started volunteering at Orlando Health.
So tell us what happens when you take the dogs into the hospital. How do you decide what patients get to visit with him?
Sure. At Orlando Health, we actually have a system that when you're a patient, you can make a request to have a therapy dog come to your room. Okay. So the first thing we do as a volunteer when we come into the hospital is we check a list of all the patients that would like to visit with the therapy dog. So we basically make rounds, very much like a doctor might make rounds. So we go room to room and we visit with patients. And some visits are short, some visits are long. And research has shown that even visiting for as little as a few minutes can really help calm someone's you know, just it's a calming effect and a distraction from the stresses that they might be feeling, and often can be also a motivator. Maybe someone struggling with getting up and out of bed after a surgery, a dog might help motivate them to get up and go for a walk down the hall.
Have you ever had anybody who says, "Can I take him home with me,
Oh,
please?"
absolutely, absolutely,
Okay.
yes. Yeah.
So how many teams, you and your animal,
Yep.
are there?
We have about 50 teams at Orlando Health visiting patients in the 6 hospitals, and that totals about 45,000 visits a year.
Wow.
So these dogs they're doing their part of the patient experience at Orlando Health.
Now, if someone's watching and says, "Oh my goodness, I want to do that with
Sure.
my dog," is that possible? And how would that work?
Yep, absolutely. One of the things it's important to mention is that as a team, you need to be registered with a national organization before you come to volunteer at a hospital. Orlando Health honors 3 different national organizations. And we can help people who are interested get connected with those national organizations. I'm an evaluator for one of them. I hold evaluations every few months, so new teams can come through and get registered. So once you're registered, then you can come to Orlando Health and then become involved in the program there.
So when you said hospice, I find that very interesting.
Mm-hmm.
How is that different? Or is it different from visiting someone in a hospital?
Oh, absolutely. Even within the 6 hospitals, there's so many different patient populations. And really every dog can have, maybe be better suited for one population versus another. Simba does very well with cancer patients. There are some dogs that do great with kids. Some dogs do great with behavioral health patients.
Okay.
And hospice obviously is a much lower key, calmer environment. Some dogs just do beautifully in that environment. So a lot of the hospice organizations in the area have therapy dogs.
Is there a particular breed that you prefer over another when someone wants to get their dog involved in this program?
Well, no.
Okay.
We interview, if you're registered with an organization, a national organization, we will interview you. It's more if you and the dog are a fit for the healthcare setting, because
Okay.
there are a lot of challenges and things that your dog needs to be comfortable around very large floor cleaners and a lot of, elevators and things like that. So those are some of the challenges that maybe some dogs would be better in a different environment. But
Okay.
so that's the process we have to go through to make sure you're a good fit in the hospital situation.
And how long have you and Simba been a team?
Yeah, we've been a team for 3 years. Yeah,
Okay.
and he was a dog that he was registered at a year. The dog does need to be a year old to be registered, and he started working right at a year and has just enjoyed it. He absolutely enjoys this work, and
It's amazing how calm he is. And one of the things you said before we started taping,
Yeah.
you said, don't play with him
Yeah.
because he gets distracted.
Yeah.
But they have to have the right temperament.
Yes.
And that's obvious because
Yep.
he's just, I'm
Yeah.
just chilling out,
Yep.
waiting to,
Yep.
for somebody to play with me, which
Yeah.
we're going to play with him after,
Yeah.
during the break, trust me.
Yeah, but they understand their job. They absolutely understand their job and very much enjoy it. Yeah.
Thank you for what
Yeah.
you do. And when we come back, we're going to hear from another team and find out exactly what happens when the dogs visit the patients. We will be right back. Won't we, Simba? Yes. We're continuing our discussion about pet therapy with volunteer team member Jacqueline Randolph and Tori. Tori and Simba are definitely stealing the show. Tell us a little bit about Tori. What kind of dog is she?
Tori is a St. Bernard Golden Retriever mix, and she comes from the Orange County Animal Shelter. She was tied to a fence post and left, and Orange County picked her up and brought her to the shelter, and she was heartworm positive. So she did have 2 applications, but both backed out because they were very nervous about the cost of the heartworm treatment.
and now she is in service
Yes,
to
ma'am.
people. Now,
Yes,
how
ma'am.
long have you been a part of this wonderful program?
I'm going on 6 years, and Tori's been with me for 5.
Okay, and Tori, we learned earlier from Amy, the dogs have to be registered, they go through some kind of training.
Yes, ma'am.
They have to make sure they have the right temperament.
Yes, ma'am.
So what made you decide to do this?
I have been a hospice volunteer for 15 years, and that's when I found my first pet therapy dog and really wanted to get into that program. And so when I brought Tori home, her temperament was so calm, even under the pressure of the heartworms, that I felt like if I could get her through the heartworm treatment, that she'd be the dog that I had been searching for.
And obviously you two have made it work.
Yes, ma'am.
So we call this program the softer side of healthcare, but there is a unique ability, and it's been studied, that animals have in sensing different things, when people are sad, when they're happy, but these dogs can sense the degree of illness someone has. Tell us that fascinating story that we talked about earlier about what happened when you took her into a hospice.
Yes, ma'am. My belief is that what man made for evil, God meant for good. And so I think Tori is a godsend, because when she went into the nursing home, we had gone to a patient. I asked if she would like to have a dog visit, and she said, I really don't think I can handle it because I don't have my dog anymore. And I said, do you think perhaps we could try it? So she said, absolutely. So it got to the point where she would tell the nurses that her dog was coming to visit. So Tori would rush in and just be, super excited to see her. Well, as the patient got, towards the end of life, I went in by myself. And she really couldn't speak much, but all she said was, where's the dog? So I rushed home to get Tori, and I brought her back. And Tori was not her exuberant self that day, which, I didn't understand. I almost got a little upset, why aren't you acting like you should be acting? And so she went over and she licked the patient's hand and she laid down. And so I thought there was something wrong with Tori, so I said, okay,
and
it's time to go.
that was not a normal reaction for the dog.
No,
how would she normally behave?
Tori knows when she's going to the hospital. As soon as I put her vest on, she knows. But when she walks in, she does have a little, pep in her step, and would rush in to see this patient. And so this day she didn't. She walked over, she licked her hand, and she lay down on the floor. And I was almost a little bit embarrassed, like, why aren't you acting the way you normally do? And so when we left, it was very shortly after that the patient passed away. So Tori knew that that was her job, to go and kiss her hand and say, it's okay, and lay down very calmly. I did not know that.
Amazing. And has that happened since?
She knows when people are sick. Like she senses a difference, because the staff at the hospitals love to see the dogs as well.
Sure.
And so she senses the difference in, I'm going to see a patient who needs me to be calm and, and be there for them, for the emotional support, versus the doctors and nurses who, hey, I can have that pep in my step and have a little bit of fun.
So you actually notice a change in her temperament depending on the patient that she's visiting. So we talked about how fascinating these animals are, and that stuff like that always fascinates me, because you can't explain it, but it happens. How has this changed you, being a volunteer with this program?
It's made me want to do it even more. As a matter of fact, I did rescue another dog who was a bull mastiff, and he is now a pet therapy dog as well. So I have 2 pet therapy dogs, and from the shelter and from the hospital, and seeing what the joy that the dogs bring to the people, my husband and I now own 10 dogs.
Oh my goodness. So are you going to get them all involved, or are some of them like not ready for prime time?
Well, and it's more, like I said, the temperament is the biggest thing. Like all of our dogs are trained for your sit, your stay, but it's a different demeanor to walk into a hospital. I have one who's...
Okay, so how is it different? Tell me.
Because Tori knows that she has a job per se when she walks in and knows that she's there. I have another dog who passed all the tests, but when he goes in, he's a little skittish. So it doesn't work well for him in a hospital setting.
Okay.
But like I said, it's just like with people, they have different personalities, different characteristics. The biggest thing what I'd love for people to realize is it can be any dog if you take the time for the training and take the time to acclimate them to the situation.
Now, do you train them?
I actually, I do go to a trainer, and with Tori, we did 2 6-week classes, and she prepared me for
It's amazing. She heard her name and she said, am I ready for my close-up? I love this. Okay, so she went through 2 6-week trainings.
Yes, ma'am.
Is that typical for most animals?
You know, for each person it varies. I come from a military background, so I'm a perfectionist, so I wanted to pass the first time. So I had, my trainer help me step by step to tell me what to do. And then when I got my second pet therapy dog, I went right back to her and did the same thing.
Okay, so what are the steps for someone who's listening and says, yes, this is what I want to do?
I mean, for me personally, I say go with a personal trainer.
Okay.
You go and they teach you, the basic sit, stay, leave it, but you have to know the situations for a nursing home or a hospital. And you go in and,
Would a normal trainer know how to do that, or is that something that the team learns as a part of just going through the process?
I mean, I think most most trainers that are, I would consider universal in their training do know that. But it's one thing that, if a door slams, Tori cannot react negatively. I mean, she can go like that and look, but she can't act negatively. Or, and barking, some dogs get excited and bark. That's not a good thing to do in a nursing home or a hospital.
Okay.
So that's what the trainer helps you with. And then with Orlando Health, they have continuing, I call it continuing education, just like people do,
Yes.
They do events and they do get-togethers and offer us, at no charge to help us continue with our dog, to learn new steps.
This is fascinating. Thank you.
Thank you.
And I have to tell you, Tori was a little excited before we started, but once the camera started rolling, she just said, okay, you need me to chill out? I'm good. Thank you so much.
Thank you so very much.
Thanks,
I appreciate
Tori.
it.
We will be back right after this. We've all heard the saying that a dog is man's best friend. Well, the folks at Orlando Health are taking that one step further. We've talked to you about the softer side of healthcare, and these dogs are making a huge difference in the lives of the patients they visit. I hope you enjoyed learning about that program just as much as I did, because we want you to always have healthy connections. I'm Annetta Wilson. We'll see you next time.